So the today's topic of discussion is case taking, understanding of man in disease. Now, many times my friends from modern medicine used to ask me, what do you think the major difference between homeopathy and modern medicine? And there are many answers to this question. We can say that the laws and all the miasmatic background and all the discussion, but what I personally felt is modern medicine look for disease in man, and homeopathic system looks for man in disease. And that is the huge or biggest difference between the understanding of the pathology of the disease, and this make our approach more unique. Now, as we all know that the pandemic is going on and many peoples are suffering, and the most successful pathy in this pandemic, which is treating the people, is homeopathy. I can say that the homeopathy had brought a paradigm shift. Initially, people were taking admission to course of BHMS for as a backdoor entry. Many people called it as a backdoor entry. But now the people from modern medicine are taking entry into homeopathic medicine, and this is because the understanding of modern medicine, they are looking for a disease in man, and homeopathy is looking for man in disease. Homeopathy is looking for man in disease, and how to understand the man in disease is totally depend upon the uniqueness of case taking. Now, our objectives of case taking. Objectives of case taking are collection of data and to diagnose the case, to prognose the case, and to treat the case. Now, if we look in the inst- instruction given in Organon for the case taking by Hahnemann and any clinical book, for example, Hutchinson's clinical methods or Sapira bedside art and science of bedside examination, we can see the tremendous similarity. Almost all the things we are discussing in organon and part of case taking, we are discussing in a college, and the given by modern medicine or in the clinical books like Hutchison, like Sapira. I especially recommend all of you to go through the Sapira Art and Science of Bedside Examination. I felt Sapira could be a more homeopath in the modern medicine because the case taking instruction or case taking precaution he had given in excellent manner. They are very close to the homeopathic case taking suggested by Dr. Hahnemann. But still, the difference is that they are looking for disease in man and we are looking for man in disease. Now, when this today's lecture we are teaching in a college how to take the case and students are taking the case, but here my motive to take today's lecture is not the making like a theoretical case taking, but the understanding the mindset which is essential for homeopath while taking the case. So the objectives of case taking are very simple: collection of data, diagnosis, prognosis, and treatment. But it is so easy, not so easy to train homeopath to the collection of data in homeopathic manner. So the training of homeopathic physician goes in few points: that accurate and unprejudiced observer. We know that unprejudiced observer, and many people had written the short note as a student. We had written the short note of a student. But as we know that the history taking is a social kind of a social interaction between physician and patient. Now this interaction has to get some unique rapport. This rapport makes a physician to understand the patient as a person. Now, understanding patient as a person or understanding the personality of a patient is the uniqueness of homeopathy. Means the man in disease, not disease in man. Then the problem, understanding what problem patient is facing, and the solution, giving an exact solution to the problem of a patient. This all is possible with accurate and unprejudiced observation. Then we do cross-sectional studies of patient. We are going to discuss in next slide what it is. Then longitudinal section study of a patient. Those who are senior doctors, they understand. But for the students, I'm going to explain this. Then diagnosis, importance of diagnosis of a disease, diagnosis of a patient. Now, diagnosis of a disease, almost everybody knows, but diagnosis of a patient means diagnosis of patient personality. Then diagnosis of homeopathic medicine. See, free communication between doctor and patient have some therapeutic value. Many times, those people who are taking objection homeopathy as a pseudoscience, they say the homeopathic medicine does not cure, but the cure is because of the interview or case taking. Yes, it is true, but it is true for every system of medicine, not only homeopathy, but it is true for modern medicine, Ayurveda, or any system of medicine, because a proper rapport, proper flow of emotion, release of inner tension, release of inner tension makes the patient comfortable, and this is proved. So, the case taking has some therapeutic value. Case taking has some definite therapeutic value. Please mute everybody so there will be not be disturbances. Now, for the understanding of accurate and unprejudiced observation, importance of accurate and unprejudiced observation, let's understand what is meaning of prejudice. So we have written the short note on prejudice, but unprejudiced observer. But what is the real understanding of prejudice? Prejudice means emotional state produce favorable or unfavorable reaction to situation. So those who are prejudiced, they have favorable or unfavorable reaction to the situation. Now, becoming unprejudiced, how to get rid of it? By self-awareness. So we should know thyself. We should know ourselves. Now, this is something a level of spiritual or all those yoga and all those religious practices. Self-awareness. So homeopath, to be a good homeopath, we should self-aware and awareness especially about our prejudice, our understanding. Just 1 second. So our understanding of self. If homeopath knows himself well, homeopath is aware with him how he is as a person and what are his prejudice, then and then only he can get rid of prejudice. Now, how our concepts are formed? We have some concept of reality. Now, from where does this concept of reality comes in? These are due to training. What we are trained. Now, I will tell you one funny story. When Newton took admission to the physics, his teacher, his head of department, told him that why you are wasting your time in physics. There is nothing more to explore in physics. So every time, every branch of science, people are having some understanding concept of reality. And when there are some rebellion peoples, they rebel, they does not satisfied like Hahnemann, like Newton. The people rebel and they disobey their training. They disobey the concept of reality, and that lead to innovation or scientific research. So if you want to be a researcher, you have to be little bit rebellious against the concept of reality. So when you're going to unaccept the concept of reality, then and then you can find something new. Now the concept of reality comes from training. Now as we see, many people from modern medicine, they really hate homeopathy. Why they hate homeopathy? Because they are trained for that, and due to this training, they develop some attitude. They develop some attitude. Now, this attitude is a real reason of our prejudice. If we have certain attitude, certain fixed idea will become a prejudice. So, becoming unprejudiced, we have to leave our attitude. Now, what attitude gives birth to expectations? Now, one observe what one expect to see. One observe what one expect to see. So the modern medicine, people from the modern medicine, or those who are trained in ICU, they want to see the pathological part only. They want to pathological parts only, and that's why they see only pathological part, and what rest they are not able to see. Now this is something Hahnemann called the mal observer. Why they become mal observer? Because due to training. The training gives them attitude. Attitude lead to expectations, and one observe what he expect to see. So the people from modern medicine can't see what homeopaths see because they have certain attitude. So becoming unprejudiced, first you have to become self-aware, aware about your own prejudices, attitude. Then minimum what unprejudiced, I think not prejudiced against homeopathic point of view. See, there are many point of views in a life, and life is a multifactorial. My teacher used to call me life is a kaleidoscopic. It is like kaleidoscope. Every time you see life is something different. So at least if you are not against the homeopathic point of view, you are called as a unprejudiced. Please mute. Please everybody please mute. Now, accurate observation. What we understand, unprejudiced observer, we have discussed a lot in our college days, but accurate observation, important of accurate observation, minimum interference of different attitude held by observer and faithful recording of observations untinged by interpretation. Now, why? What is the importance of accurate observation? What is importance of accurate observation? There is a minimum interference of different attitudes held by observer. Now observer have some attitude. Allopathic medicine, allopathic people have some attitude. Now if you look at neurophysician attitude is a little bit different from psychiatrist attitude. Now the orthopedic attitude is different from all the rest. So every branch due to training they have attitude. Now, if you want to accurately observe, your minimum interference of different attitude held by observer. So first you have to leave your attitude and faithful recording of observation. Now you have to record what you had said faithfully, untinged by interpretation. Now don't interpret, recording. Now what is the problem? People have interest in interpretation. People have interest in interpretation rather than observation. So if you want to become unprejudiced observer, if you want to become unprejudiced observer, then you should record without interpretation. While case taking, your attitude should not come between and your interpretation should not come between. You have to write what you observe, what you listen in patient language. Now this is really difficult because as a doctor, we have analytical mind and we start interpreting before completing the case. So here for the accurate observation, dear friends, please don't interpret while the process of case taking or history taking. Don't interpret, only become observer. Okay. Now cross-sectional studies. Once you complete your history, once you complete your case, once you complete your history, once you complete your interview, you have to go for cross-sectional study of patient. What do you mean by cross-sectional study? It gives an idea of present illness. It gives an idea of present illness, whether disturbance is on a physical level, emotional level, or intellectual level. Physical level, emotional level, or intellectual level. It gives idea of present illness. But the idea of present illness is sufficient for the acute disease, but it is not at all sufficient for chronic disease. For chronic disease. And why? Because if somebody has giving water to a plant whose leaves are shedding at the root, now, if somebody comes and tells you why you are giving it a root, you should give water to the leaves because leaves are growing, then that means it does not understand what plant it is. So, by only study of acute totality or superficial totality or presenting complaint. Now, if you look in a modern medicine, they have interest in present illness. They have more interest in present illness, and many students where the problem in a case taking occur, they limit themselves to the present illness. Present illness study is sufficient for the acute, but not at all sufficient for chronic disease. So if you want to study the chronic disease, then you have to do longitudinal section study of patient. What is longitudinal section? Study of personal history, right? Study of personal history, right through early formative years along with the family background and understanding of social, cultural affinities and please mute, please everybody please mute yourself. I will try to mute all from my side. I don't have that setting. Anyway, longitudinal study of personal history right through early formative years. So if you want to treat a chronic disease, your history from presenting symptom is not enough. You have to go back to early formative years. Early formative years. Please, please mute yourself. Please mute yourself, Swapnil. Please. So the study of early formative years, growing age, through the growing age, what the person suffer is very essential. Or you have to ask the history of the early formative years where the personality form. You can see the teenage, childhood, teenage, and understanding of family background. Now many diseases, genetic diseases are getting from generation to generation. Tendencies are going generation to generation, and not only genetic disease, but diseases like diabetes, hypertension, cancer, all have some root in the genetic and family history. So you have to understand what is it we are calling is a miasmatic history. So you have to go for the family background and understanding of social and cultural affiliations enable us. Now social, cultural background of a person is very essential. If you want to understand a person, because person is not only physics, it's not only physical body, it is the social interaction. Let's understand. So I hope you understand the longitudinal study. Now the diagnosis of the case. Why it is important of diagnosis? We are not prescribing anything on the basis of diagnosis. We are not prescribing anything on the basis of diagnosis. And why we are diagnosing? Hello, everyone, please mute yourself. Everybody, please mute yourself, please. I don't know whose mic is mute.
Santosh Desai.
Santosh Desai, please mute yourself.
Sorry, sir.
No problem. So the prerequisites, okay, just 1 second. I think. So we had finished a longitudinal study. Then diagnosis. Why? Because understanding the pathogenesis. Now, how does disease comes? How does what the actually system is suffering? Then physiological and pathological disturbances and the structural changes. My friends, diagnosis is very essential in homeopathy. If you want to give a homeopathic medicine, you must know the pathogenesis, how diseases evolve. So even though we are not giving medicine on the basis of diagnosis, still you have to diagnose the case. And how you will diagnose the case? By knowing the history or by knowing the case taking. So the case taking, your eye should be focused on the diagnosis, but not only your diagnosis. So by understanding diagnosis, you can understand the physiological and pathological disturbances and the structural changes happening in a body. Structural changes happening in a body. Now the diagnosis of patient. So if you diagnose the disease is not enough. We don't want a disease in man. We want man in disease. So how you diagnose man in disease? What kind of person he is? What kind of person he is? What he made? What happened with him? And the final question, why he fallen ill? Now, if you understand why he fallen ill, then you understand the diagnosis. See, there are two ways of thinking. Few people believes that the disease is caused by bacteria or virus or pathogen. Now it is called the germ theory of disease. And for some time, the germ theory of disease set back homeopathy. Initially, people were thinking The internal body factors or host factors are responsible for the cause of disease. And now we had come to the conclusion, not only host factor, not only pathogen, but the interaction of host and pathogen is responsible for the cause of disease. Now here, when you consider the host factor, you have to consider him person as a whole, means what happening on a psychological level, why he fallen ill. Even though the disease is caused by the bacteria or the virus, for example, if the disease is caused by the COVID, still COVID in every patient is a different. If you will get no symptom, asymptomatic carrier, if you will is mild, moderate to severe. And to understand this, you have to see the psychological makeup, the number of stressors, psychological stress, tension. Then you will understand why he fallen ill. So why he fallen ill means not the bacteria or virus, but the internal host factor which make him to ill. Now, diagnosis of homeopathic medicine. So history taking, diagnosis of disease diagnosis of a person, and diagnosis of homeopathic medicine. Homeopathic physician should be conversant with the principles. You know the principles, tools like Metra and posology, and the technique of application of principles. Mean case taking, case analysis, synthesis, and repertorization. Now, for this, you should have some prerequisite. Now, what are the prerequisite in case taking? First, the patient should sit in a comfortable manner. You should give him a good atmosphere. The privacy, your clinic should have enough privacy. And these all the physical factors means the patient should get a comfortable sitting arrangement, privacy. Then all this beyond that, what is important is that the internal qualities of homeopath, that he must have tremendous interest in his patient as a person. If you are a homeopath, then you must have tremendous interest in your patient as a person and unfailing love for the mankind. So many times the homeopathic doctor arrange a neat, nice clinic. They provide a good setting. They provide a good privacy. But if you don't have the love for the patient, then you cannot get the complete entire understanding of person as a disease. So even though if you don't have the good setting arrangement, still if you have that tremendous interest in your patient, your history taking will be better. So what is the most important prerequisite of history taking is your inner attitude toward patient, your love for the mankind, and your desire to help the patient. So if you want to become a good homeopath, be those qualities inside you, polish your those qualities, have love for the mankind, and have take interest in patient. Your interest in patient gives you a better history. Now, obstacles. There are many obstacles, and the most important obstacle is that the materialistic mind is unable to grasp important role played by emotions in genesis of ill health. See, modern medicine, they are taught like the person is like a machine and the spare part works in accordance with each other. The person is like a machine. Now they are doing the organ transplant because they consider body as a machine and they does not consider any role of emotions. But this approach failed in even modern medicine, as many diseases have psychosomatic in origin, like diabetes, BP, cancer, your allergies, your autoimmunity have the background of emotional part. So if you have the materialistic mind, you believe that human means only body, you are making a big mistake. You are making big mistake, as human are not only body, but they have mind. And this mind is very essential, as causative agent lies on a mental level. I will tell you a story today. Just today evening, I got a call of my friend who is a very strong person, and he gets some symptoms, his wife gets some symptoms, and I asked him to do the RT-PCR that turned to be positive. But immediately once he noticed he have COVID, he collapsed. A strong man collapsed and start crying and asking for the begging for the bed. Now what happened? He don't have the symptoms, but he become emotionally collapsed. Now this make future he land in a complication, because he developed a tremendous psychological stress, and that psychological stress leads to hyperadrenergic drive. He will secrete endogenous steroid by adrenal gland, excessive secretion due to sympathetic stimulation, and this will suppress his immunity, and he will land in a problem. So understanding human as only machine is just a failed object, and those still keeping that kind of mindset, they are actually the obstacle to cure. They are having obstacle to cure. Now, how not to do it? History taking, how not to do it. Now, this is really something which is, you will find that he, why it is important. See, in college, the our teacher teaches us very nicely how to take history, what to do in history taking. But my approach is a little bit different. What not to do it in a case taking, what things you have to avoid. First, stiff formal manner. If you believe you are a doctor and you are something superior to the patient, you are making mistake. Then abruptness leading to tense atmosphere. Many patient comes to tell you that this doctor is very strict, he is shouting on a patient, then I will tell he is not a doctor. If you are using abrupt language, you will disturb. If you are a homeopath, if you are like this, if you have an aggressive kind of personality, you are failed. You will never successful. Then frequent glancing at a watch. Few people have some habit. Glancing at a watch, looking outside, how many patients are waiting, why the patient is timing. If you are hurried, you are failed as a homeopath. Don't be never be hurry. Things, these are the things physician must avoid while taking history. Then inordinately long history taking. If you are taking excess timing in history, then you are boring a patient. Then patient will give you pleasant reply, then they will conceal the information, then reveal. They will conceal, they will not give you information, but they try to reveal. Then patient may have some superstitions. You should not ridicule towards them. Your attitude should be understanding the patient, not ridiculing them. Then the never get involved emotionally. You should be aware of your own emotion and don't get involved emotionally. Then what to do? What not to do? Then what to do? See, what to do is really a good question. You must be skilled listener. You must be skilled listener. Now, every human being, not the doctor, every human being like only one voice, that is his own voice. They like to talk, but they are not like to listen. Human mind is a little bit. Okay, what to do? What to do is be a skilled listener. More attention should be given to how it is said than what it is said, how the patient speak than what the patient speak. You have to be conscious. You have to be conscious what patients say than how patients speak. So you have to be skilled listener. So develop your habit or develop your hobby of listening. Develop your hobby of listening. It is really tough part to listen, because listening, we like to talk than to listen. Then skilled interrogation. Now many times it is said that it is not the history, it is history taking, not the interrogation. It is interview, not the interrogation. See, leave the patient in a freedom always is a key of successful interrogation. Even though if you don't want to interrogate the patient, still for some part you have to ask some questions. So skilled listening demand concentration and training and very alert mind. If you are alert mind, if you are well trained to listen, then you will become skilled listener. This skilled interrogator, leave the patient in the freedom always, is a keynote of successful interrogation. So don't interrogate like a police. The interrogation should be a polite, gentle. Then assessment. See, physician should start assessing patient as soon as he enter into room, because your assessment is very essential for understanding person, as the body language speaks more. It is said that the verbal language is a 35%, remaining 65% is spoken by the body language. If you are interested in body language, you can refer the nice book by Dr. Ajit Kulkarni sir, where he explains how to assess patient by using the body language, how he walk, how is a posture, because body never speaks untrue. I have one patient, a couple, old couple, come to my clinic, and husband was telling the history of a wife, and the body language of wife, that whatever the husband is telling, it is exactly reverse. So I write the history by only getting the facial, by getting the facial gesture of a patient, and I write down the entire history reverse what her husband was telling, because body never fails you. Now, the clinical record. Clinical record. Please mute yourself. Please mute yourself. So for homeopath, the case recording is an asset. Case recording is an asset. If you keep the record of your patient, in modern medicine, they did not worried about case recording. Nowadays, because of medical legal issues, they are keeping up the record, but that is very brief. As an homeopath, you have to take the record clinical language, patient's language, and keep it forever with you. In patient word, record must be in a patient word, and intensity of various symptoms must be recorded. So in history taking, you have to record the intensity of each and every symptom. Now here many times we make the mistake, because we record the symptom but not the intensity, and when we lead to the repertory, we have a problem in judging the intensity of the symptom. The method, write history in own patient own word, we are taught in a college. Additional symptomatology elicited by interrogation. Your findings in physical examination is result of investigation, diagnosis, chronological consequences of symptoms, and case analysis, classification of symptoms. Now, case synthesis. Conversion of symptoms into rubric and repertorial analysis. Now, this part is really tough, because conversion of patient language into the language of rubric is a really tough skill. And for this, you have to get command on the English language, because all the repertories are written by foreign teachers, many team like Kent and Birminghausen and BBCR. So they have the abundant knowledge of English language. So if you want to be a good homeopath, you have to skill yourself in the English language, refer the dictionary, and the conversion of symptom into rubric is the toughest part in homeopathy. If you got that art, if you have that vocabulary of English language, then and then only you can convert. And if you successfully convert this, then your history taking is successful. Then you can do the repertorial analysis. Then general line of treatment. If you want to give some additional line of treatment, you have to mention it. Then the first prescription. See, the first prescription is a toughest thing. So for which you have done your entire process of understanding person, and if you are damn sure that you had understand the person, then and then only prescribe. Then and then only prescribe. So never be hurry of your first prescription. Then follow up and subsequent prescription with their indication. Most important in homeopathy is follow. As per my experience, your first prescription is not always unfallible. Many times, because interview or the case taking never end on a first session. When you do the follow up, you start understanding the person in a better fashion. So follow ups and subsequent prescription might give you more success than your first prescription. So if your first prescription fail, don't get nervous. Don't get nervous, don't get anxious, don't leave. Go for a follow-up, and your subsequent prescription are going to give you success definitely. So the summary in short, understanding the patient is one of the most difficult tasks for the physician. So if you have good history, good data with yourself, then you can come to a good conclusion of the history. So history taking is not mere a dry process. You have to become your understanding as an homeopath. And if you want to understand the exact process of history taking, and if you want to become a homeopath, I recommend you to read the book of Principle and Practice of Homeopathy by Dr. M.L. Dhawale sir. This book will help you to become a better homeopath, or you will understand how to think like homeopath. If you understand how to think like homeopath, then you will become your case taking will become automatic process. If you are a homeopath, see, the fish need not to teach how to swim. So if you become mentally a homeopath, your history taking or your case taking and understanding of man in disease will be perfect. Okay, so thank you for you kind patient listening. If you want to ask something, you can ask me. I will try to help you. Mm, I hope you understand the basic idea behind the case taking. Okay, we have 1 more minute. Any questions? Anyone? Anyone have a question? Okay, so once again, I'm very thankful for patient listening. I hope I can arouse your